Bismillahirrahmanirrahim. Today we are going through the fifth question of the series of quiz, which we are doing in relation to hypertension. And today's subject is pharmacological treatment. So with the same pattern, now I'm going to share with you the screen of the question. And here is the question: which of the following is most accurate regarding drug therapy for hypertension? You can read the four options. For patients with significant hypertension, simultaneous use of an ACE inhibitor and an ARB is often recommended. Beta blockers are recommended at first-line medication to treat hypertension in most patients. Aldosterone antagonists are contraindicated in patients with resistant hypertension. Women receiving medication for hypertension who become pregnant or planning to become pregnant should be transitioned to methyl dopamine or labetalol. Let's see the right answer. And here the right answer is the last option. The women receiving medication for hypertension who become pregnant are planning to become pregnant should be transitioned to methyl dopamine or labetalol. A very important thing to be considered when you are managing a patient with hypertension who's female in a childbearing age. If she's pregnant or planning to become pregnant, that is a very important description in this system, that whenever you're dealing a patient, and this is often neglected, especially in our setup, these patients usually come up to a doctor after 6 or 12 weeks of pregnancy and tell the doctor that we are pregnant. Now, every hypertensive female who is on ACE or ARB especially should be counseled that whenever you are planning a pregnancy, you should be transitioned from these drugs to these three: methyl dopamine or labetalol. Labetalol is usually used in emergency situations. Let's discuss other stems as well. Aldosterone antagonist is not contraindicated. It's indicated in resistant hypertension. Beta blocker recommended, no more recommended as first line agent. It's only recommended when your patient is having a very strong compelling indication for beta blocker selections, and which are that if your patient is having angina, if your patient is having tachyarrhythmias, if your patient is having heart failure. These are the few common compelling indication of the atrial fibrillation, so tachyarrhythmias. So these are all. And ACE-ARB shouldn't be given in combination. They are contraindicated. Let's see some of the guideline-based recommendation of drug selection. Now, for initiation of antihypertensive drug therapy, first-line agent includes thiazide, CCB, ACE, or ARB. So, beta blocker is not there as a first-line agent, especially in a patient who's having no strong, compelling indication of beta blocker. But out of other four, you can choose anyone as your first-line agent. This is an again important point which I want to mention. Initiation of antihypertensive drug therapy with two first-line agents of different classes, either as separate agent or in fixed dose combination, is recommended in adults with stage 2 hypertension and an average BP more than 20/10 above their target. It's very clear and descriptive that if your patient target is, for instance, is 130 and 80 and is having baseline pressure of 160, which is 30 above systolic of his target, and diastolic, for instance, 1010, again 20 above the 30 above the target. So if your patient's target blood pressure is like 140/90 and his baseline pressures are 20 above the target systolic and 10 above the target diastolic, then you can start with two medication straight away. And this is again a class 1. And these two drugs either in combination or separately, very important. And that is something about pregnancy. Women with hypertension who become pregnant or planning to become pregnant should be transitioned to methyl-dopa, nifedipine, or labetalol during pregnancy. And women with hypertension who become pregnant should not be treated with ACE inhibitor, ARB, or direct renin inhibitors. I think these four quiz will help you to at least approach to different aspects of hypertension, in which we covered starting from blood pressure measurement in first one, in second we covered etiology, in third we covered complication, in fourth we have covered non-pharmacological treatment, and this fifth one which was related to pharmacological treatment. But they were just hints. There is, you can read volumes on individual subject, but ideally these five prongs should be covered when you're managing a patient with hypertension.